Hello, everyone. My name is Hamza Hashmi, and um, I'm an assistant professor in the Division of Hematology Oncology at Medical University of South Carolina. In my clinical practice, I focus on multiple myeloma and amyloidosis. In my practice, I treat patients with newly diagnosed myeloma with chemotherapy. I take them to bone marrow transplant, and I also offer them cellular therapy with CAR T cell therapy and bispecifics. Today, I will be talking about late myeloma relapse, and we'll be focusing on patients and the treatment options with triple class refractory multiple myeloma. Few words about the current treatment landscape of newly diagnosed multiple myeloma that I believe will serve as a perfect segue into late relapse and triple class refractory myeloma. Multiple myeloma is the third most common blood cancer in the United States right now. It's more common in African American individuals and happens to be the most common blood cancer in African American individuals. It's more common in men who are above age 50, and men who actually have a family history of multiple myeloma. About 35,000 people get diagnosed with multiple myeloma every year. When we see a patient with newly diagnosed multiple myeloma, we like to risk stratify them based on their medical conditions, their physical fitness, and their caregiver support into two brackets: patients who are transplant eligible and patients who are transplant ineligible. Patients go through three cardinal phases of myeloma treatment when first diagnosed, and those stages include a stage of induction chemotherapy, followed by either a bone marrow transplant or more consolidation chemotherapy, and finally patients go on to maintenance chemotherapy. Multiple myeloma, as of now, in 2023, is considered to be an incurable cancer, which means that patients, once they start their maintenance chemotherapy, actually continue that for as long as the myeloma continues to respond to the chemotherapy and as long as they continue to tolerate the maintenance chemotherapy. However, there are clinical trials that are evaluating limited duration maintenance chemotherapy for patients. I like to describe the myeloma journey of a patient as a journey of peaks and valleys. When myeloma first diagnosed, gets chemotherapy, goes into remission, stays in the remission for a considerable period of time, but only to relapse later. And when that happens, we give more chemotherapy, different chemotherapy, and try to bring the myeloma back into a remission status. And that journey of peaks and values, remission and relapses, continues as the patients go through it.